Hello everyone, it's Dr. Fox. Let's talk about the thoracic cavity. In this video, we'll discuss the relative position and boundaries, as well as contents and subdivisions of the thoracic cavity. We'll also discuss the locations and contents of the pulmonary cavities, as well as the mediastinum, its subdivisions, boundaries, and major contents. The thoracic cavity is generally the area that sits above the abdominal pelvic cavity, below the neck, and medial to the upper limbs. But we can more narrowly define those boundaries. First of all, the superior boundary of the thoracic cavity are the first ribs. And so the root of the neck is where the first ribs exist, and we can think of the upper limbs as being superolateral to the thorax. The inferior boundary is that of the diaphragm. So we have the superior and the inferior boundaries. Let's then go around. Laterally, the ribs and the intercostal spaces. And these are going to come around to the anterior, where the sternum is the most anterior aspect of the thoracic cavity, and to the posterior, where the vertebral column is the most posterior. So, root of neck, diaphragm, ribs, sternum, vertebral column are all bounding the thoracic cavity. And because the ribs are bony elements, they provide a great deal of protection for the contents of the thoracic cavity, namely the heart and the lungs, as well as other viscera and neurovascular elements. When we think of the thoracic cavity, we can subdivide it into three spaces. Laterally, on each side, there are pulmonary cavities, which contain the lungs. These pulmonary cavities are lined by serous membranes called pleurae. The lungs also have visceral pleura on them, as we'll discuss later. Central to the lungs, or I should say medial, but also a little posterior and a little anterior, depending on your perspective, is the mediastinum. The mediastinum is this central region of the thoracic cavity. It contains the pericardium and within it the heart, surrounding viscera, things like the trachea, the esophagus, the great vessels coming off of and to the heart, and any of the neurovascular elements that are serving parts within the thoracic cavity. So, pulmonary cavities and mediastinum. So let's drill down on each of those spaces. The pulmonary cavities contain the lungs as their major contents, and they are lined by serous membranes called the pleurae. The pleura, so on either side, will have two distinct components to it. There is the parietal pleura, or the parietal layer, and that is the part that is adhered to the walls. So whether it's the rib cage or the diaphragm or the region that is adherent to the mediastinum, all of that is parietal pleura. The visceral pleura is adhered to the lungs. So there's one lung, and this is an example of atelectasis, or a collapsed lung, just to exaggerate the space between the parietal and visceral layers. So here we are with a gigantic pleural space here. And this is going to be a concept that we see repeated time and time again, not just with the pulmonary cavity, but with the pericardium as well. So serous membranes have three distinct components. There is a parietal layer, a visceral layer, and between them, a space. And we can modify the names depending on the context. As this serous membrane is in the pulmonary cavity, we call it the parietal pleura, the pleural space, and the visceral pleura. But in the pericardium, there's the parietal pericardium, visceral pericardium, and pericardial space. But we'll get to that. It's just a very high return on investment of your understanding to drill down on this now. Central to the pulmonary cavities is that of the mediastinum. It's the most central thing within the thorax. Over here is a lateral view of the mediastinum, and we have different colored spaces here that denote different parts. So there's a superior mediastinum, an anterior mediastinum, a middle mediastinum, and a posterior mediastinum that we'll get into shortly. This space contains a lot of important features, namely the heart within the pericardium, any of the great vessels of the heart, lymphatics, the trachea serving the respiratory system, the esophagus serving the digestive system, etc. There is a lot going on here. So let's look at the parts and their boundaries. And we're going to use some of the thoracic vertebrae as a guide for where we are within the mediastinum. So let's start with the superior mediastinum, and it would be very helpful to then begin with the concept of the thoracic plane. The thoracic plane is an imaginary plane that runs from the angle of the sternum, also called the angle of Louis, posteriorly back to the intervertebral disc between T4 and T5. So above this thoracic plane and below the first ribs, we have the superior mediastinum. So anything below that you would presume is the inferior mediastinum, but nobody calls it that. Rather, we have three subcomponents. It would be helpful to begin in the middle. So outlining this green space here. In the middle here, we have the middle mediastinum is defined by the pericardium. So anything within the bounds of the pericardium is that middle mediastinum. So it is running from about the T5 level to the T8 level, where the pericardium is adhered to the diaphragm. The anterior mediastinum is everything anterior to the pericardium and posterior to the sternum and superior to the diaphragm. Now, what I want you to do is take a look at how curved this diaphragm is. This is going to come back in an important way when we discuss the respiratory system. And so that anterior mediastinum, whereas it sort of has its superior portion at T5, it goes down inferior below the bounds of the middle mediastinum to about T9. Now that posterior mediastinum is everything behind the pericardium or posterior to it and anterior to the vertebral column, but we can see that it goes down way far behind the diaphragm. So while it has a superior edge at T5, it goes down all the way to T12. So we can begin to understand some of the diaphragmatic recesses by means of the mediastinum here. So superior, anterior, middle, and posterior mediastina. So let's evaluate some of this knowledge. Which space within the thorax contains the heart? A, anterior mediastinum. Nope. B, middle mediastinum. Yes, absolutely. It's defined by the pericardium, and the pericardium contains the heart. C, posterior mediastinum. Nope. D, pulmonary cavity. No. E, superior mediastinum. No. If you were just asked this question, mediastinum generally would be correct, but the most correct answer would be middle mediastinum. Thank you so much for your time, and I look forward to talking to you in the next video. Take care.